This is Dr. Troell talking about the difference between facial implants and facial fillers. If you look, most common procedure aesthetically done in the United States is neuromodulators. So that would be Botox, Jeuveau, Xeomin, Dysport, and now Doxify. That is for treating animation wrinkles. Number two is actually volume replacement using fillers. 95% of the people who do volume replacement are not surgeons. They are trained in using an absorbable filler. Hyaluronic acid being the most common. So you have Juvederm, Restylane, and Versa. Those are the more common hyaluronic acids FDA approved in the United States. However, there are other options. Permanent volume replacement would make sense. 2/3 of my patients prefer a permanent solution. There was the Harris poll that interviewed people on using temporary fillers, and this was in 2018. What they found was 9 million Americans per year do volume replacement. Over 2/3 were not happy with the duration that their filler lasted, which is classically 5 to 9 months before they want a repeat injection to the same anatomical area. Over 80% would change providers to go to a person who does permanent volume replacement. So when we receive patients who want volume replacement to their face and body, we discuss all options, which is fillers, both temporary, and the only FDA approved permanent one is Bellafill. I practice in Las Vegas. There's really only one other provider that has any significant volume of using Bellafill. We can put it anywhere except for the lip. So we have a huge amount of patient satisfaction rate, over 96% using Bellafill. The negative thing is expensive. So other alternatives, especially if you have pan volume loss, so everywhere your face is deficient, using your own fat. So autologous fat transfer, we add your own stem cells and platelet-rich plasma from your blood to improve the fat survival rate. But fat is a good alternative, but unfortunately you get about 80% of the volume that stays long-term. Implants, if you put an implant in, you get 100% of what you want. If you don't like it, it's reversible. You can take it out. The advantage with implants over temporary fillers is permanency. It's reversible. You can take the implant out if you don't like it, change it to another size. There's custom or patient-specific implants, so you could have an implant for any part of your face. There's standard implants that we use for the chin, angle of mandible, premaxillary area, nose, cheekbone or malar eminence, submalar or underneath the cheekbone, the entire face, tear trough, temporal, and lip. So there's all these implants that are available. The advantages, again, they're permanent, they're temporary, far exceeds that issue with temporary implants or temporary fillers. So the advantage is permanency with facial implants.